So May is actually BPD Awareness Month, and I wanted to share some excerpts from this book that I've been loving. It's by Dr. Fox. He has a great channel on YouTube talking about cluster B personality disorders. The book is called Complex Borderline Personality Disorder, and it's essentially how coexisting conditions affect your BPD and how you can gain emotional balance. And I'm also someone who has comorbid conditions. So I'm going to start by sharing from page 15 under the title, Why Your BPD is So Confusing. BPD is confusing to many mental health and medical providers, but it's probably substantially more so for you as someone living with the disorder and for the people who know and interact with you on a regular basis. This confusion comes from the overlap and similarities in symptoms associated with BPD. For example, criteria for BPD include intense and erratic interpersonal relationships characterized by alternating between seeing others as either heroes or zeros. But this has many similarities with those in a manic, hypomanic, or depressive episode. In a manic or hypomanic episode, someone may love someone 1 minute and then respond to them in an angry and irritable manner the next. An individual who's sliding into a depressive episode may appear to devalue or lessen the importance of the person who's trying to help them because they're non-responsive or communicating a sense of worthlessness and lack of appreciation for their efforts. BPD is also perplexing because it's associated with multiple psychological, social, and biological issues. Biologically, when looking at pictures that depict frightening or adverse images, such as fearsome animals, reptiles, or insects, or bodily deformity, BPD patients have been found to have a greater amygdala, which is an almond-shaped mass in your brain involving emotions, and occipital lobe, which is the visual processing center of your brain. So that activity, when compared to those who don't have BPD, the neurological activity produces a heightened response, often making it challenging to calm down and return to baseline. These biological differences and the associated challenges add to the difficulties that often lead to misdiagnosis, frustration, and confusion by all involved in the treatment, but also by those who are concerned for your well-being. Many times, due to the multiple and overlapping issues associated with BPD, mental health providers often assess symptoms in an unstructured way, meaning no formal assessment procedures or approaches are used. And when mental health providers don't use structured measures such as systematic and consistent approach to interviewing and diagnosing individuals, there is more than a 50% chance of missing co-occurring conditions. And from personal experience, that is 100% true, as I was only diagnosed last year in April, and my main doctor for years thought there's no way that it could be BPD because I seemed more quiet about it when really it was just like behind closed doors and all signs were missed. And due to this unstructured practice, the average time between onset of symptoms and formal diagnosis is more than 7 years. Also accurate. Over this time, your BPD symptoms may worsen as you go from therapist to therapist and continue to erode your self-concept and relationships as you struggle to find solid footing in your life. The stigma of BPD. If you were diagnosed with BPD, you may have felt overwhelmed with a tidal wave of thoughts and emotions that include varying degrees of confusion and terror. This isn't an uncommon response to hearing this diagnosis. You may have also felt a sense of liberation that at least you know there's a name for what's going on inside you and causing problems in your life for so long, and I can attest to that being true. At the same time, when you research BPD, you may notice that the stigma is prominent and provides a sharp sting. You likely found the fellow descriptors: treatment resistance, difficult, overly sensitive, antagonistic, manipulative, and many more. Seeing this may have brought you back to, or even encouraged, that all too familiar sense of hopelessness and despair. After learning of the intensity and pervasiveness of the BPD stigma, you may not even tell your mental health or medical provider you've been diagnosed, or think you have it because you've encountered or are afraid to encounter those who refuse to treat or associate with you because of it. There is little debate that the stigma associated with BPD adversely impacts perception, accurate diagnosis, management, and treatment availability for this disorder. The stigma of BPD is unwarranted as the effectiveness of treatment for BPD is well documented, typically involving 2 to 3 hours per week for 1 or more years with a trained mental health professional using efficacious intervention. These interventions include dialectical behavior therapy, DBT, mentalization-based therapy, or transference-focused psychology. And I'll finish this section off with the part that BPD is a real disorder. You may have been told to just stop it, you're being dramatic, or other dismissive statements of blame for your BPD related beliefs, behaviors, and reactions. These declarations assume that BPD is a choice and that the issues that drive destructive behaviors are willful and planned. But the reality is that they're not. BPD isn't a choice, nor is it a choice to destroy your life or the lives of others. It's a disorder that develops out of an attempt to manage years of anguish and disappointment. Sadly, it often comes with the lack of supportive compass that shows the way to resources that build a sense of self that's caring, hopeful, and balanced. Knowing the symptoms and the causes are a critical part of the process. I hope this made some of you feel less alone and more understood within the confusing realm that is BPD. I'm going to be sharing more from this book and certain exercises that were shared by Dr. Fox to further help you all out and just get to know ourselves better and understand what we're working with. I'm sending you all a lot of love, and please know that you're never truly alone.